Welcome to Cutting Edge Pain Relief. And today we're talking about obesity and knee pain and how the two may influence one another and really how that's something that you can be able to take a handle on and hopefully be able to improve your overall pain. If we haven't met, I'm Dr. Orlando Landrum, a regenerative medicine and interventional pain specialist that helps individuals understand what are your options, how to be able to punch pain in the face, and how to get back to leading the life that you deserve. Today, we're going to talk about a topic that many people talk about all the time. Basically, they say if you're overweight, then you're probably going to have pain from some form of arthritis. And perhaps that holds a little bit of truth, but what we really want to kind of delve into is the science behind it. So we have a better understanding about, is this accurate? And if so, through what mechanism does this occur? So for those of you who are joining us live, by all means, pitch in, ask questions, add comments, and we'll see what we can do about being able to address this. Most people, when we think about obesity, we think about this frankly, grossly overweight kind of pictorial representation, sort of kind of like this, right? And on one end, you have the spectrum that looks like the gentleman on the left, and on the other end, you have the spectrum on the right, right? And accordingly, if you're the person on the left, then you probably have a whole host of different ailments, specifically that of arthritis and knee pain. If you're a person on the right, then you very well may not have that. Well, just kind of giving the ability to kind of dispel this right off the bat is that doesn't always hold true. As we know, it's different from person to person. A number of videos ago, we talked about things like osteoarthritis biomarkers, which are ways to be able to kind of see arthritis before it develops on x-ray and have kind of a precursor and an understanding, in essence, kind of like a warning flag. Or if you were to use an analogy like a canary in a mine, when it's going to be an issue, when it's going to be a problem, and how you can be able to intervene sooner. However, there have been a number of studies that have looked at this, particularly those of knee osteoarthritis. So when we talk about osteoarthritis, obesity, and weight loss, one of the things that they have looked at is, so what's the reason for why these are intertwined? And one of the things that they have kind of come to some salient points are the following, is that obesity is a risk factor for the progression of osteoarthritis, and it can obviously negatively influence other disease outcomes. We kind of knew that though, right? And so we're going to delve into a little bit more about what that means, look at some fancy graphs and some pictorial representations. We're going to break it down so there's a better understanding about that, right? But one of the other things that they basically state is weight loss can prevent the onset of osteoarthritis, relieve symptoms, improve function, and increase quality of life, right? So we also assume that that's the case. And I think many people think that the area that has to deal with arthritis is due to this load and the significant increased weight that the knee joint is having. And so when you have this weight load, then it's going to automatically cause a problem. And actually, it's probably a little bit different than that. So if we really were to kind of hone in on this and kind of get a little bit better understanding and assessment as we kind of take a look at this graph, one of the things that we can kind of see is the following. Is so if we were to look at obesity, right, and we were to see that it can give these different pathways where you have a change in fat infiltration, that you have a decrease in overall skeletal mass, you have these compressive forces that we think about all the time, and you have this fat accumulation. So if you look at the arrow over there, that's the second one from the left, this is what we think about most commonly, is that you have these compressive forces. And these compressive forces result in aberrant biomechanics. So let's spell that out in regular English. Basically, we have this altered physical stressor on the bones in a different way, which changes the gait and can potentially cause joint degeneration. However, there's something that's actually probably a little bit more prevalent and isn't really talked about all that much, which is really kind of important. And that is this fat accumulation and intramuscular fat that's present. It can cause a number of different molecular elements to have either an increase or decrease expression. So what does that mean? So that means that you have this one marker that can result in systemic as well as local inflammation. So you can have an increase in IL-1 beta, an increase in IL-6, an increase in TNF alpha, and an increase in CRP. And so we're going to talk a little bit more about that as we get into depth and detail about what do those things do. But the long and short of it is that they can cause inflammation, which then can affect the joint adversely and actually hasten osteoarthritis, right? So that's what we're dealing with when we talk about what obesity can cause, is those two different elements, not just mechanical load, but also that it can cause a problem with inflammation as an issue. So most people will say, well, if that's the case, then I really have to start measuring my diet. I have to start looking at everything that I take, and I have to say, okay, well, if I'm doing this for the diet, then I can only have a quarter of a sandwich or an eighth of a sandwich, and then I'm going to be better. Well, there's been a number of papers that have looked at, is intentional weight loss for overweight and obese knee osteoarthritis in patients is more better. So how much do you really get in terms of an impact? And what has really been shown and what people have found is the following ratio, which has been quoted a few different times. And that is that if you have weight loss, a 4-fold reduction in the load exerted on the knee is what you will get for every pound that's lost. So reading this in full is this particular paper, which is actually cited from this paper, as a matter of fact. So for those of you who are my kind of science junkies, it's from Arthritis and Rheumatology, and I believe it was published in 2016 with the following authors. But what they found was the following, is the results indicate for every pound of weight loss, it will result in a 4-fold reduction in the load exerted on the knee per step during daily activities. And this is cumulative in nature. So if you look at that over thousands of steps, a reduction of this magnitude would appear to be clinically meaningful. So taking it from the fancy language to a layperson's language, right? For every pound that you lose for the knees in terms of osteoarthritis, it's almost like you lost 4. And I think people can be able to kind of get that 1-to-4 ratio. So if you're losing 10 pounds, which seems like, a fairly significant amount, it's like you lost 40. And that is a considerable impact. Now, the challenge and the issue is, in all practicum, is the following. Most people already have knee pain when they're overweight. And the challenge is trying to be able to manage this specifically through exercise is difficult to do because it hurts when you're trying to do exercise and activity with the intent that you're trying to get to the point where it doesn't hurt. So let's talk a little bit more about that. So this diagram kind of gives us some insight about what that really means. So if we were to kind of take a look at this, it looks at the elements of osteoarthritis. And what you can see on the left are the potential elements of inflammation. So things like an increase in adipose tissue or in fat, right? Or you can have changes in your glucose level where you have a hyperglycemia, which you might have with various different states, but specifically within that of diabetes. Or you have other changes that are going to cause inflammatory responses, which can affect the spine. It can affect the hip. It can affect the synovium of different joints, and it can affect, even small joints like the hand. And so what you can see is that those systemic effects of osteoarthritis can cause an increased mass of inflammatory mediators, which are things that we mentioned earlier. And so those things have actually has been shown to have even broader impact on other systemic diseases, things like Alzheimer's, things like stroke, things like myocardial infarction. So when we look at how broad this is in nature, it's not just about the mechanical load as what was stated originally in the beginning, but it's also about the inflammatory markers that can really impact things in a very adverse way. So what most people will say is, okay, well, if that's the case, then how do I decrease my inflammation? And I think that that's a very good question, but it's also pretty involved. So when we look at how inflammation affects the aspect of osteoarthritis, one of the things that we see is that it can come from a couple different mechanisms. It can come from trauma, where you have an accident or injury that can cause inflammation. You can have low-grade inflammation that can occur. You can have inflammation that can occur from aging. You can have inflammation that can occur from different changes that are present in terms of how you respond to your body as a whole. And so these things can then result in those systemic release of inflammatory mediators. So in essence, if we're using kind of fancy medical language, it's multifactorial. What that basically means is that there's multiple different things that are potentially causing that inflammation. So kind of backing that up and trying to reassess that is if you have trauma from repetitive doing the same mechanical load motions, whether you're a runner or you're increasingly stressing that joint in some fashion by doing a repetitive movement over and over again. If you have a genetic predisposition where you're more likely to have an inflammatory response, after a period of time, you have a more likelihood of having an inflammatory response. And sometimes if you have things like a metabolic syndrome, you can have a more of an inflammatory response. So even though you might be able to mediate that with some degree of diet, you may not be able to take all your risk factors for inflammation down. So osteoarthritis is an inflammatory disease, and this is referring to arthritis, not arthrosis. And so what does that look like? It looks like the following. So when we, for instance, take a look at the knee joint, we can see that there's low-grade inflammation that can result in this cytokine cascade, which is in essence a way that the body kind of talks to itself. And that obesity causes that, as we stated, or changes in inflammatory response. And what it results in is actual direct changes to the elements of the joint. And what we see in those changes are the following: is we see osteophyte formations where you have kind of calcium deposition. You can see cartilage degradation that takes place. You can see the synovium, which is the area that surrounds the joint, have inflammation that can cause issues. In the knee, you can see meniscal degradation. In the areas underneath the cartilage, which is the subchondral region, meaning below the areas of the cartilage, you can have changes in the bone and other issues. And you can also have a loss of muscle mass and overall strength. So when those things occur, it's multiple different issues that cause a problem with the joint. And so when you try to be able to improve that, it becomes really challenging. So when we kind of evaluate that, one of the things that we want to say is, all right, we have this inflammation, we have this mechanical load. We know if we lose 1 pound, it's like we've lost 4. Can we be able to decrease our inflammation as well? And there are reasons and why you might want to consider an anti-inflammatory diet in order to be able to improve your overall pain relief. There have been a number of studies that have looked at this. And one of the things that they have looked at is really, how does this factor out over a period of time? And so when we take a look at a couple of different meta-analyses, and for those of you who follow our channel pretty frequently, you know that we really lean into this greatly. So meta-analyses are the blend of different studies that are pooled together to be able to identify, did this make a difference or not? So this one paper looked at meta-analyses that looked at 177 subjects, 450 subjects, and another 454 subjects, and then kind of evaluated what happened over a period of time. In the first study, what they looked at was after 16 weeks of a restrictive diet, what happened. The other looked at 18 months of an energy restricted diet, and the others looked at 6 weeks to 18 months of different nutritional impact. And what they were able to find is that if you're able to get this diet, which causes this weight reduction of anywhere from 13% in the first study, that you were able to see a 30% reduction in pain. So again, let me kind of reiterate that. Let's say you average it as 15%. It's almost a 2-to-1. If you're able to reduce your weight by 10 to 15%, you may be able to reduce your pain by about 30%. The next study looked at WOMAC scores, which are a way of being able to assess how functional you are, meaning how much can you do. And what they're able to see is that there was an improvement in function with significantly less pain, almost by a 2-fold increase in function. And the final study also looked at pain and disability and looked at what happened in terms of weight loss. And if you were able to reduce your weight by about 5%, you're able to see an improvement that was significant in nature that helped you be able to say, okay, this really was able to not only improve my pain, but what I'm able to do. And what many people think is, well, if you have um, just a weight loss component, it only matters in terms of the mechanical load. Well, it's not just the mechanical load, it's also the inflammation. So, for instance, I've had patients that have lost weight and they've had an increase in pain, which, was perplexing and seems counterintuitive. But what you really have to be able to assess is their inflammatory status potentially worse than what it was previously. You would think it shouldn't be, because as you kind of lose some of the elements of that adipose that's causing inflammatory marker increase, that you should have some degree of improvement in pain overall. But that's not the case for everyone. So it's kind of a balance, right? So you want to decrease your mechanical load, you want to decrease your overall inflammation, and hopefully with that, it will not only improve your pain, but it also will be able to improve your function. So today was a quick talk looking at all the nuances of how knee pain is affected by your weight and BMI, and how overall it can be something that you can control in order to be able to improve your pain, so you can be able to punch it in the face and get back to leading the life that you deserve. Hopefully this was helpful for you. If you have questions or comments and you weren't live during this video, leave them in the comments below, and we'll see what we can do about being able to make sure that we can answer those questions and give you the answers that you really need. Thank you so much for taking time out of your day to listen to this video, and have a great day.